Well, good morning, everyone. How are you? I appreciate you guys coming out this morning. I'm super excited about this morning. I'm hoping that you walk away with a lot of new information and just get your questions answered with regard to Medicare in general. It sounds like it went off. So I'm hoping that you've got a lot of good takeaways this afternoon. You're able to take a look at the information that the Louisiana Department of Insurance has provided for you. And I heard someone say earlier that it sounds like we've given you homework. So I'm sorry. I'm just hoping that you've got a lot of information at your fingertips and that you can make the best decision for you regardless of what that decision is. But thank you so much for coming out. My name is Trish LaBeouf. I didn't introduce myself. I would like to introduce staff. Staff is in the back row. If y'all just stand up, that's Ms. Dana Romero. Y'all tend to know Miss Ashley Wright. She's your retiree specialist. We've got Miss Tamara Reeves, and we've got Miss Candy Toops, who's in the back. So I've got a few staff members with us today, figuring that you may have some questions after the break. I wanted to just draw your attention to, we tried to provide just a general agenda. Louisiana Department of Insurance is going to speak first. They've got a wonderful presentation available for you today. Then we're going to have a short little break. And then the department sent out open enrollment communications to retirees on text message, and we also call members if we have your information on file. I saw a couple shaking heads, so make sure today, if we don't have your point of contact, if you did not get the district communications, please connect with the staff member. That way we can make sure to get your information. But I figured you may have questions about that. I'm going to come back and pull up the open enrollment guide and just try and answer some of your general questions. More specific questions, we'd be happy to dive into it deeper with you. We can either call you or email you back, whatever works best for your preference. But I do appreciate y'all coming out today, so I'm going to turn it over to the Louisiana Department of Insurance, the Director of Insurance. All right, Ms. Vicki Dufresne. I'm hoping I didn't mess up your last name, so I appreciate it. Thank y'all so much.
Thank you, Ms. Trish. Good morning.
Hold on 1 second. Holly, test. I don't think they're working.
Those green. Can you hear me now? Okay, so you got to hold it up close. So that means I have to act like I am Taylor Swift or Ryan Foray or one of the good ones. We'll go with them. Gigi Shin, any of those good ones my husband loves so much. So let's see if we can get this party started here. Why are we not? Oh, okay. Oh, she's doing it from the room. Gotcha. Okay. Oops. You gonna? There we go. Okay. So good morning. As Ms. Trish was kind enough to introduce, my name is Vicki Dufresne. I am from the Louisiana Department of Insurance. So I'm from across the Atchafalaya. I'm from Baton Rouge. Actually, I'm a little bit further south. I'm more or less closer to Hammond than anything. But thank y'all so much for coming out, and I want to thank the school system and Ms. Dory for having me come and try to see if I can give you some basic information, make sure we're all on the same page and understand where we are going. And I, like you, am in the midst of open enrollment for my own self. Not just for the Medicare side of it, but for my health insurance too. So I know how overwhelming it can get at times. So what I'm going to talk about first and foremost is in that bag that you picked up off the table. We will get you a bag. We will get some bags. Don't worry about that. So how many of you did not get a chance to get a bag off the table? Okay, so we need about 4 or 5 bags. Okay. Wonderful. So let me ask this. How many of you, and hello to those of you at home that are watching us, how many of you have a Medicare and You book at home? Majority of you? Okay. If you don't have one and you would like one when you go for the break, there are some out on the table. Remember, Medicare only sends one book per household, even if both of y'all are on Medicare. So everything that I'm going to talk about today is in your Medicare and You book. But I also have you some handouts within those bags that we are going to go over. You should have a handout that says a quick guide to Medicare and Medicaid. In the back of it, because I know you have a lot of papers in front of you, but if you take this little guide and you open it from the back going forward, there's a spot for you to make notes. If you don't have an ink pen and you want to make some notes, we will make sure to get some for you. But inside of it, you will have some little stuffings, and we'll go over those as we go through the presentation. But the main thing is I wanted to let you know that you do have a place to make notes and that everything I'm going to talk about is in your Medicare and You book, and you can also use this guide to get through a big portion of what we're going to talk about as well, because I want to make sure that you all have a good understanding of what is Medicare. What is it? I'm not sure, but maybe I can tell you in a minute. Goodness gracious. I'm directionally challenged today, people. It's Monday. So one of the things I want to tell you is the information I'm going to provide to you has a disclaimer. I am not an attorney. I am not the federal government. I am a state employee with the Department of Insurance, but I do direct a program called SHIP that is within the Louisiana Department of Insurance. And if you take your Medicare and You book, flip it over to the back, this is me on the back cover. So I am a legitimate person. I am not one of those telemarketers that calls you on the phone 52 times a day. I will be glad to answer questions for you, but what I am going to give you is information that will help you as an education to be able to make the decisions that you need to make. So first and foremost, let's talk a little bit about what is Medicare. It's health insurance. It's what you and or your spouse worked and paid into the Social Security. It is federal government insurance for the most part. You've been working, you've paid into Social Security, and this is the end result. So for most of us, it comes at age 65. That's the golden age. But there's a lot of confusion because if you've ever talked to Social Security, there's different dates for different things. So just to kind of clear that up, age 62 is the earliest that an individual can draw Social Security benefit. However, if you draw at 62, your benefit is reduced. And it's pretty much now a permanent reduction. And then at 65 is the golden age for the health insurance piece of it. And then for like me and my husband, 67 or 68 is what they call the full retirement age, or FRA. That's the age where if we retire and are eligible to draw Social Security benefit, we could get the most benefit that we've paid into the system. So there's lots of different ages for lots of different things within Social Security. And Social Security is the gatekeeper for all of these different programs. That's who you go to when you need to get your check every month. That's who you go to when you need to get a Social Security card. That's who you go to when you need to get Medicare. That's who you go to when someone passes away to get that deceased benefit, that little bitty $250 or $55, and then maybe get some other income based off of whatever the spouse was drawing. So they are the gatekeepers for a lot of things. Main thing being they are the gatekeeper for our insurance, our Medicare side of the insurance. So it's for someone that typically is 65 and older. However, younger individuals are entitled to it as well, and especially those that are diagnosed with ESRD, end-stage renal, that's the dialysis, or they may have Lou Gehrig's disease, ALS. If that being the case, those individuals, for the most part, get Medicare early. They don't have to wait till 65. If you are under 65 and you become disabled, then you can apply for Medicare, and if approved, you have a 2-year waiting period. And within that 2-year waiting period, you would get other insurance, but on that 25th month, you would be eligible for Medicare. So Medicare comes in a variety of parts or pieces. Initially, you have A, which is your hospital, B, as in boy, which is the doctor or the medical side of it. D as in drug. Those are the A and B are the original. If you remember, that's what's on your red, white, and blue card. D does not come on that card and never, ever, ever will, for the simple reason that D is run by an insurance company. A and B are basically run by the government, the federal government, when it comes to establishing eligibility for it. So, some of you may have gotten a Social Security check at 62. That being the case, when you turned 65, you got a Medicare card automatic in the mail. Or you may have been declared disabled by Social Security, and your red, white, and blue card came in the mail automatically. That's fine. There's nothing against that. You also get this little packet. And it typically comes about 2 to 3 months prior to the beginning of your Medicare, your eligibility. For others of us, example, I'm going to pick on my husband because he's not here to defend himself, so I can talk bad about him. He's 64. He made 64 in September. He wants to work another 4 years because he thinks we live under the railroad bridge by my house because we don't have anything. Every time I ask him for something, we don't have money for that. We don't have money for that. Well, we do. We're not that bad off per him. But anyway, so when it comes time for him at 65 next year, September, he will be 65. And he's not drawing his check yet because I'm making him wait. He will have to ask Medicare. So he would have to go to Social Security and make the ask. And this is the website that you would do to make the ask if that's what you want to do. Now, some of us, including myself and my husband, will probably work past our 65th birthdays. Well, I'm not. I can tell you that. He probably will, but I'm not. So I will have to make the ask to Social Security when the time gets here. He will have to make the ask too, but in 2 separate different occasions, and we'll get into that in just a second. But this is where you would go if you needed to ask Social Security to start your Medicare. Once you ask them to start it, this is what your card is going to look like. It is going to be the red, white, and blue card. It is going to have your name, and it will also have what is called your MBI, your Medicare. They say Medicare number, but it's the Medicare Beneficiary Identifier. If you remember, your old cards had a social on it, Social Security number. And it may have had an A at the end, which meant you were drawing benefit off of yourself. If you were lucky enough, in some cases, to be stay at home, or you just maybe not have worked long enough to put in all your quarters, you may have had a B on the end. That meant you were drawing off of a spouse. Some may have a C, which means that you're a disabled child and had a child drawing off of a benefit, or D, which meant you're drawing benefit off of a deceased spouse. And then some could have numbers behind them as well, which meant there were other individuals entitled to benefit off of that work record. Now they use a mix of letters and numbers to try to help prevent fraud because it was so bad when we were using our social, so bad. But now it's a little bit better. So if you have misplaced this card, do you know how to replace the card? You do it through the Social Security Administration. Remember, I told you they're the gatekeepers for everything. But an easy, easy, easy way to do it. So let me see a show of hands in here. Does everyone in this room have Medicare? If you do not have it, let me see you raise your hand. Okay, just a couple of you do not have it. Okay. So those, yes, sir. Okay, we'll talk about adding B. So for those of you that have Medicare, whether it's just A, it's A and B, maybe it's just B. If you misplace this card, if you write that number down, your Medicare number, you can go to Medicare.gov and create an account and download a copy of this card and even request a new one to come in the mail. That's the easiest way. Otherwise, you are going to Social Security to prove your identity and everything else and get one. And has anybody been to Social Security lately? Did you pack a lunch? A snack? Well, lucky you. You go. Because a lot of times, and I know in Baton Rouge, I have pulled up to pick up some publications from them here about 2-3 months ago. And they knew I was coming, and there was probably 8 or 10 people sitting on the hoods of their cars in the front. And I'm like, oh, my goodness, these poor people. But, you know, it is kind of what it is. So we're going to go on. Any questions on the card? Okay, so you have an enrollment period. And that enrollment period starts out with your initial, which is typically your birthday, your 65th birthday. That is what we consider to be your initial enrollment period. And it starts 3 months before your 65th birthday, the month of, or 3 months that follow. Now, if you get Medicare due to disability, when that card comes in and tells you when your Medicare is going to start, that is also your initial enrollment period. 3 months before, the month of, and 3 months that follow is when you have the right to make choices in what health care coverage you would like to go along with Medicare. How many of you think Medicare is 100% coverage? It covers everything at 100%. Good. Y'all all passed the class. Because it does not. The easiest way to think about Medicare is it's an 80-20 split. Now, there are going to be some flat copays on some things, but for the majority of the services that you seek in a lifetime, it will be an 80-20 split. So I'm going to back up for a second. So I'm going to go, oops, I went the wrong way. So I'm going to go right back here to getting started. And the reason I'm coming right here is because this gentleman said that he had just Part A. And if you know anything, Part A is based off of your work history. You have to work at least 10 years and pay into Medicare, into Social Security. If you looked at any of your check stubs when you were working, you had a Medicare or FICA tax on there. That was meant that you were paying in. And I know as a school board employee, because I'm a state employee, we pay into a separate retirement system. We didn't pay into Social Security unless we worked outside. However, in 1983, they came around and started changing the law, and then in the late 90s, early 2000s, they came back and said, hey, we want to know if you want to participate in Social Security. And you can you can go back and catch up, or we can go forward. Well, many of us just started going forward at that point. Some paid back, but most people just started going forward and paying into Social Security. So you pay 10 years, 40 quarters of what they call substantial gainful employment or activity. Means that you are paying a minimum. This year it's roughly around $1,300 into the Social Security system per quarter. You pay that in there and you earn a quarter or a credit, as what they're now calling it. And when you've got at least 10 years in there, 40 quarters, then you are entitled to Part A at no cost. If you don't get those 40 quarters paid in, then you're going to have to pay a premium. And Part A premium for less than 30 quarters is roughly over $500, right around $500. And that is paid every month. Now, some of us will be eligible for Part A benefits, maybe off of a spouse that worked outside the school system. So I'm a state employee. My husband's in law enforcement. But we both are paying into retirement, separate retirement systems. But he's been paying into Social Security. He's 64, so he's been working since he was 16. So he's paid in quite a few quarters over his time period. So he would be eligible for all of his benefit. Yes, ma'am. Sure.
I saw Mr. Touchette walk in the door. I'd like to introduce him just for a brief moment so he could say good morning.
Good morning, all.
I don't think he doesn't need the mic. Thank you.
Uh-huh.
Taking time out of your busy schedules, and I'm sure you have lots of other things to do, but I want to first of all commend Trish and her staff for, number one, reaching out and making sure that we are focused on making sure that you guys have all of the information available so that you can somewhat make decisions moving forward. I want to first of all address a few different things with you, and I want to just kind of throw it out there. Is that, one, we are very much open to this discussion about what can we do to kind of help meet the needs of retirees. I want you to know that we truly believe that you guys have given so much to the system that we need to kind of hear your voices, okay? What the one thing that I'm going to say to you is, and maybe this is not the case when you were employed, but guys, I am the superintendent and I'm faced with all of these decisions, like, for example, 1,300 less kids. 1,300 less kids. We have this district optimization. We're having all of these different things that are happening. And what we need to do is we need to kind of take a holistic approach of what we're looking at as far as how school is actually moving forward and make good educational decisions. Again, I understand that some of that means it has to pass on to certain people and so on and so forth. But I want you to know that we have an insurance advisory panel that actually meets with me quarterly. I'd like for you, if you would like to be part of that or be listening in on what's going on there, is really try to participate and be a part of those. If you need, please reach out to my office and they'll tell you when those different meetings are. But please know that you guys are very much part of the discussion, and we're having those discussions because we really want to meet the needs of where everyone is so that we can kind of keep this within a perspective. So, again, I want to thank you for taking time out of this. I'm hoping that you gather as much information as possible, and hopefully this will be, not just the beginning of something, but we need to continuously involve you guys in some of these discussions so that you can be where you are as far as your health is concerned, okay? Y'all have a great day.
Thank you. So, we're going to go ahead and pick up where we left off. Now, we talked about the quarters that you earn to get Medicare Part A at no cost, and when your initial enrollment is. That's that golden age of turning 65, or the first time you sign up for Medicare would be considered your initial enrollment. Now, for some, there's a special enrollment. That would be an 8-month window at what time you decide that you are no longer going to work, or you're a dependent, or your spouse is a dependent on your policy, and the one carrying the insurance, okay, drives the bus, per se. And so we have to follow that individual. So there's also a special enrollment period, and it's an 8-month window when you can sign up when you work past. We're going to focus on I'm working past my 65th birthday. Excuse me. And that 8-month window starts the day I decide that I am no longer going to work and start retirement. And we're just going to say that's going to be November 1st. Oh, goodness. I have to turn my papers in fast. Then you will have an 8-month window at which to pick up your Medicare. Excuse me. Water went down the wrong throat. A wrong pipe in my throat. You also have a general enrollment period, and that would be January, February, and March. And your Part B and RA would start the month after you apply. Typically, this is when people forget to sign up for B during their initial, well, I don't need it. I don't want to pay the premium. I'm in good health. I'm not going to take my B. Well, then they get caught in a limbo because they've retired, they don't have any insurance, and now all of a sudden they are at the general enrollment, January, February, and March, and they may be on the hook for a penalty. Excuse me. Whenever you apply, the part that you are applying for will start the first day of the next month. Now, if you took A, and I'm going to pick on you for a moment, sir. You took A when you decided to retire. You're not retired? Okay. So you would qualify then for the special enrollment period, first of all, when you decide that you no longer want to work. You want to come off of the school system's insurance, or not even come off the school system's insurance. You just need to sign up for Part B as in boy, because you've worked past your 65th birthday. So you would apply for the special enrollment period, which would be an 8-month window. We're going to act like you're retiring for November 1st. You would have November, December, January, February, March, April, May, June. Well, you're caught up in all the excitement. You've been planning this retirement all these years, and you missed that 8-month window. Your next opportunity to apply will be January, February, March. If you went longer than 12 months from when you stopped working, you've opened yourself up to a late enrollment penalty. That penalty is 10% for every 12-month period that you didn't take it when you should have. And it's based on whatever the Medicare Part B as in boy premium is. So some people have to pay an extra premium, late enrollment penalty, along with their premium. So if this is you, oh goodness, I totally apologize. If you do not have it, then I am going to suggest we have a conversation because you want to avoid getting a penalty. Okay, now, how many of you are getting bombarded right now? Just a few? Just a few of y'all. So now is the yearly open enrollment. The plans could start marketing in October. They can market until December 7th. If you are not on the group plan, you have until December 7th to make a change if that's what you choose to do. If you're on the group plan, then you have to follow the group plan timeline to do whatever they tell you to do when you need to do it. This is every year that you can join or change plans during this time period. And we'll talk a little bit more about it in just a minute. So we talked about some enrollment periods. Now let's talk about some out-of-pocket cost. Because some of you are wondering, well, if I come off the group plan, what am I looking at? So we are going to focus on you having just Medicare, no other insurance at this moment. If you have just Medicare, Part A and Part B, and you go to the hospital and you're admitted, you have an out-of-pocket cost, and this is for this calendar year. These figures are subject to change, and you have a sheet in your packet that looks like, it says 2024 rate sheet. It has Part A and Part B cost on it. I'm going to borrow someone's real quick. Yes, ma'am. I'm going to give it right back. It says ship across the top. It looks like this. It says ship right across the top, and that's Senior Health Insurance Information Program. Although sometimes I kind of wish I could drop the P, but I can't. Can't drop the P and add a T, although it has come across my mind a time or two. So if you go in the hospital and you stay 1 day or 60 days, your responsibility is $1,632. Yeah, if you go in the hospital, you've broken a hip, and you go to Lafayette General and they admit you, and you have surgery, you have a hip replacement. You are in the hospital for 5 days, and they send you home. You are home, and all of a sudden, you're trying to get up, and you fall, and you break the other hip, and you go back in the hospital. Or you break an arm, and you're back in the hospital. You are still within what we consider to be your initial benefit period. So if you look on your sheet, it says 1 to 60 days. So Medicare looks at a hospitalization benefit period as 60 days, 60 consecutive days. You are still in there. To break a benefit period, you have to be out of the hospital or the facility for longer than 60 days before you have another admission. If that happens, then you start a new benefit period all over again. So in this instance, I broke a hip. I went to Lafayette General. I stayed 5 days, $1,632. I go home. I'm not home but a couple days, and I'm readmitted to the hospital because I fell and I broke a shoulder instead of the other hip. We'll say the shoulder. I go back to the hospital because I have to have shoulder replacement or rotator cuff surgery. I am still within my initial benefit period because I have not been out of the hospital for longer than 60 days. So I do not have to pay that $1,632 again, okay? Just adds a couple more days to my initial benefit period. They send me home. I stay in this little bubble-wrapped eggshell, and I don't move. And everything is good. I have no more hospital admissions. On the other hand, 6 or 8 months down the line, I have another episode and I end up back in the hospital. Guess what? I have another benefit period. So what I'm trying to let you know is that you could have multiple benefit periods in a calendar year, which means you could pay $1,632 multiple times throughout the year. Any questions on that part of it? Now, when you are discharged from the hospital, if you are admitted to a skilled facility or a rehab for, let's say, my hip, Medicare says the skilled periods are typically 100 days. Medicare pays the first 20 days at no charge. Beginning day 21, if I continue to meet medical necessity and need to go and stay longer, I can, but I, as the policyholder, as the Medicare beneficiary, am responsible for $204 a day for every day that I'm in there, beginning on day 21 through possibly day 100, or up to day 100. If I stay longer than the 100 days, I'm on the hook for the whole thing. Okay? Now, this is not becoming a resident of a nursing home. I may go to the nursing home for some rehab, but this is going to get some skilled care where I'm learning how to walk, talk, eat, whatever the case may be, based on whatever happened to me that put me in the facility to need this potential rehab. Hospice, when I'm discharged from the hospital because I have a terminal illness or injury, hospice is covered at 100%. Home health is covered at 100%. And so would any mental health inpatient services would fall just like it would for a typical hospital stay. Any questions on the Part A out of pocket? Just remember, if you have just original Medicare Part A, that's $1,632 when you go to the hospital. You will pay for, yes, ma'am. If you stay longer than 60 days, then they start charging you per day $408 for every day that you're in there, beginning day 61 through day 90. That's why a lot of times the hospital says, shoo, you ready to go home? Come on, let's get you up, let's get you moving. And another reason is that because you only have so many days in a lifetime to be in the hospital under Medicare. When you get past, so you can have unlimited initial benefit periods. You can go in the hospital and stay 5 days and come out and not go back in for another year or two. But if you stay in there and you use up, if you look on your sheet, it talks about lifetime days, days 91 through 150. If you've been in a facility that long, you've got something seriously wrong with you and you've used up a lot of days of Medicare days. So you don't really, that's one thing Medicare really tries hard not to get you to. That's why a lot of times they'll say, it's time to take them home, or let's put them in what we call an LTAC, a long-term acute care facility, or you may want to look at putting them in a nursing home or something, because their lifetime hospital days are limited. Now, you can have hospitalizations multiple times throughout the year and never start a new benefit period. You can have multiple new benefit periods throughout a year or a lifetime and not ever get to those 91 days. But when in that initial scenario, when I went in the hospital for breaking my hip, and then I went in for my shoulder, and then I stayed out of the hospital, I didn't go back in for another year or so, I started a new benefit period all over again on my next hospitalization. So 2 years down the line, I have to pay that whatever the Part A inpatient deductible is at that particular time. Does that kind of help a little bit with? I know it's a lot to take in, but just remember that if you go in the hospital, you will have a inpatient deductible to pay, and it is typically, this year it's $1,632, and I look for it to go up a little bit for next year. Part B, as in boy. This is the medical side. This is the piece that you will use over and over and over and over again. Your flu shots, your pneumonia shots, your doctor's appointments. Ooh, it's nap time? How many of you are diabetic? Your lancets and test strips. How many of you want your spouse to wear a CPAP machine at night so they don't keep you up? That is a Part B. That's a durable medical. The wheelchairs, the oxygen, the albuterol machines, the breathing machines that a lot of us have to use, those all fall under B as in boy. This comes with a premium every month, and it is based on your income. Now, granted, many of you in here are retired, so we'll just say we're all on a fixed income. The standard Medicare Part B, as in boy, premium for 2024 is $174.70. So if you hear me reference $175, that's what I'm talking about. However, some individuals may pay higher based off of their income. Social Security goes back 2 years. So if you are applying for Part B, as in boy, in 2024, they are looking at adjusted gross income from your tax returns for 2022. And yes, I understand you were working at that point. You didn't have Medicare. Why are they looking back? I honestly cannot answer that question as to why they go back 2 years. All I'm going to say is Congress wrote the law, and we'll leave it at that. But if you are assessed a higher Part B, as in boy, premium, they do address that every year when you file your income tax. So if you start out paying a higher Part B premium, as your tax returns decrease, then your chance of getting to the standard payment will also increase. And there are some exceptions. So when you do stop working, you can file with Social Security to tell them that you've had a work stoppage and your income has changed, and they will look at that and make a decision based on your situation. So if you're filed single, or if you file jointly, or if you file separate, it'll have it up here as to what your Medicare premium would be. If you pay a higher B, as in boy, you're going to pay a surcharge on your D. So you will have a premium for, or an extra amount you may have to pay on your Part D plan. Any questions on this part? This comes out of your Social Security check. And if you're not drawing a Social Security check, let's say you're called in that windfall where you paid in, but your school retirement check is more than what Social Security, by the time they take $2 of what you're entitled to through Social Security. This will either come out of your Social Security check, or you will get a bill from Social Security every quarter. Once you get your bill, that first one that comes in the quarter, then you can set it up to pay monthly if that works better for you. I'm a person that needs to know every month how much money I have. Quarterly does not work for me because I'm not good at saving for the quarter. I will have spent those 2 months before the first month is up. So I need to know every month. Every 3 months, yes, ma'am. And some individuals, depending on when you are eligible for Medicare, may get a bill that's a little bit more than 3 months because they're trying to get you into that quarterly billing cycle. So if you applied in September, you were at the end of the cycle starting the last quarter. So your bill would have been September, October, November, December, trying to get you caught up. That being the case, again, like I said, once you get the bill and you get paying that premium, you can set it up through what is called Easy Pay, where it can go through your checking account, it can go on a credit card, whatever works, or you can pay them every month. But when you pay them, if you are an individual that still writes out checks, which there are a couple places that my husband and I pay monthly that I still write the check out just because I'm old-fashioned about it, you've got to make sure it gets to them timely because Medicare has deadlines to make those payments. And if they're not made, you will get your Part B canceled or terminated for non-payment. And it's hard to get it back. So you've picked up Part B. Now, remember, you just have A and B at the moment. B, along with coming with a monthly premium of $174.70 in 2024, comes with a Part B deductible, yearly deductible, $240 this year. So even if you joined Medicare Part B in November and you go to the doctor, you're responsible for the first $240. But I met my deductible with my school board insurance, but you left that behind when you picked up Medicare. This is brand new. You still got to meet this one before Medicare will pay anything. It is calendar year. So if you do it now and you turn around in January, you're going to have another Part B deductible to meet come January 1st. Once you meet that deductible, Medicare covers 80% of approved charges, and you are responsible for 20%. Who knows how much 20% is? It's an unknown number because you don't know what your bill is going to be. I mean, you can go to the dollar store and they tell you it's 20% off, but you already know that it's going to be 20% off of $5 or $10 or whatever the item is that you're purchasing. But with this, you don't know what it's going to be until the bill is submitted to Medicare. So, Medicare does not cover every single thing. Imagine. The Botox that I wish I could afford to get is not covered for my wrinkles. I go to the eye doctor every 2 years to get a new pair of glasses. That is not covered. However, if you go to the eye doctor because you have cataracts or some type of disease of the eye, that is covered. I go to the dentist every 3 months just because I have a hard time flossing. I've gotten a whole lot better with it, but I just love the feel when I walk out of the dentist office. Oh, they feel so nice and clean. But Medicare does not pay for you to go to the dentist for routine dental. My dad needs hearing aids and he's on Medicare, but it does not cover his hearing aids. Treats him for disease of the ear, treats him if he has a disease of the mouth, but it does not cover for routine hearing, vision, dental, massages, anything cosmetic, does not cover for that. So the question is, if you are still working, do you pick up Medicare Part B? If you are working for the school board, no. No, no, no. When you get ready to retire, yes, yes, yes. If you are the policy holder, so I'm going to use my husband and myself here for a minute. I'm 57, he's 64. I will be retiring between now and January of 2026. He is on my insurance, so when I retire, if he is 65, he has to pick up Medicare, even though he has insurance from me. And why is that? Because I am the policy holder and I am not actively working. Social Security looks at two things when you apply for Medicare Part B. Are you the person applying for Medicare, are you actively working or are you covered by someone that is actively working? Because I will not be actively working, he will be required. And if he does not, he opens himself up to the penalty. He gets that special enrollment period, that 8-month window, because he'll be coming off of his group plan and joining mine and picking up Medicare Part B at the same time. So, yes, he would have to do it. But while I'm actively working, he does not have to do it. Now, excuse me. So we talked about the A's and the B's. Now, we need to fill in some of these gaps. We need to figure out, are we going to make a cake or are we going to buy a store-bought cake? How many of you like to make things from scratch? Not too many of us anymore. But it tastes so much better when it's made from scratch. So, on this side of the screen on the left, we are talking about original Medicare. That is going to be how we are making things from scratch. We are putting in our own eggs, whether they are yard eggs or white eggs. We're putting in butter versus oil. And on the right side of the screen, you're going and buying a cake off the shelf. It's already pre-made. And what do I mean by that? Okay, so under the original Medicare, you have A and B, which is standard across the board. But remember I told you if you go to the hospital, you got $1,632 to pay? When you go to the doctor, you have a Part B deductible to meet, plus you got to figure out that 20%. And you also have to add in some prescription drug coverage. On this side of the screen, on the left side, the A and the B, they already included the D, and they've added some extra benefits. So they added sprinkles to their cake. We're not adding sprinkles. So under the original, let's talk about that for a second. One of the ways to fill in gaps is with a Medicare supplement. This is an insurance that is sold by companies. Humana's one of them, Blue Cross, United Healthcare AARP, USAA, State Farm, Medco, Allstate. All of these companies, plus hundreds more, sell what is called Medicare supplement insurance. They're sold by letters of the alphabet, A through N, G being the most common plan sold, which means that you're going to have a premium under a Medicare supplement plan. You have to meet the Part B, as in boy, deductible, because when you look down that column, everything's covered at 100% except that Part B deductible. You meet that Part B deductible, then Medicare covers the 80%, and your Medicare supplement plan covers the 20% at 100%. So you are left with no out-of-pocket cost minus the deductible. And under this type of insurance, you can go where you want, when you want, no questions asked. MD Anderson, Baylor, here in Lafayette, anywhere you want to go, no questions asked. This coordinates with Medicare. This does not, and I repeat, not provide you prescription coverage. That's something else we have to add to it. That's why I say we're making a cake from scratch. We're picking what we want and putting it together. It does not give you vision, dental, or hearing. Now, that's not to say that the company that you may choose to be your carrier doesn't offer you something, but that's an additional benefit to pay each month. On average, I ran quotes before on Friday. On average, a person, a female age 65, looking at a Medicare supplement in Lafayette, you're looking about $120 a month. Male, you're looking at about $140 a month. Age 70, female, you're looking at about $140. Age 70 male, you're looking at about $175. Age 75 female, you are looking at about $175. Age 75 male, you are pushing $186. It's kind of like car insurance. We like it when we need it, but we don't like to pay the premium every month. That's a Medicare supplement. If you go in the hospital, Part A deductible, under Plan G, it covers that at 100%. If you go to skilled nursing and you stay longer than 20 days, it covers that $408 charge at 100%. Your Part B coinsurance or copayment after you reach that Part B deductible is covered at 100%. So anything that you need from the hospital doctor side, once you meet that Part B deductible, it's covered at 100%. N as in Nancy is another good plan. The difference between N and Nancy, as you can see, one is the Part B deductible. Another is this excess charge, which means that the doctor that you're seeing says he does not accept Medicare assignment. He doesn't like the amount Medicare's paying. So he tells you that I'm going to charge you 15% more than what Medicare says they're going to pay me. G covers that at 100%. N doesn't cover it. If you are seeing a new doctor and that doctor does not accept assignment, unless you are married to that doctor, ask for another referral someplace else. N also says that while your premium may be less than $100 a month for a person under 65, every time you go to the doctor, it's up to a $20 copay. So if you are an individual that uses the doctor a good bit, N may not be the saving grace for you or the savings plan that you're looking at because of that $20 copay. So if you go 3 or 4 times a month and your premium is $90, by the time you add $60 more to it, you could already have had the other plan, the G. Any questions on a med sup policy? You don't have one of these if you're on a school system. So remember, right now you don't have any insurance but Medicare. We're going to talk about having the school system insurance in just a minute. This is if you decide you don't want the school system insurance, is where we are at the moment. And by no means did I mean in that statement that everybody needs to drop it. This is just options for you. So, if you decide to get a Medicare supplement plan, if you are covered under the school system and you decide that the school system is not the way for you to go and you want to come off, you will have an opportunity to do so regardless of your age, regardless of your health. You can sign up for a Medicare supplement plan. But the thing you need to remember is if you leave the school system insurance for anything that I talk about up here, you don't get to go back. This is just an option if it gets to the point where the school system is not an option for you. Prescription drug coverage. So, you have a handout in your booklet, in your information, that has a list of all the drug plans. Oops, I went too far. There we go. This year we have a very limited amount, and your list should say 2025 Medicare Part D standalone plans, and on the back side it has that chart that I just showed you, the Medicare supplements. So this is the page when you go home and you're trying to make heads or tails out of all this information, you're going to have stacks. One stack will be Medicare Supplement and Part D. One stack will be Medicare Advantage Plan. One stack will be Lafayette Parish School System. And then from there, you'll be able to narrow down what your options are. On here are the prescription drug plans available. If you choose this side, one of those Medicare supplements, you have to choose a prescription drug plan to go along with it. How do you know which one is the best one for you? By using Medicare.gov. The plans are a little bit different in that their premiums vary. Oops. Their copays for the medications are going to vary, but the one thing I can tell you is that you will not spend more than $2,000 out of pocket in 2025 for drug cost. That will also be the case for the school systems, for the retirees that are on Medicare. The cap that you will be able to spend is $2,000 for 2025. That's under Medicare Part D. So these plans, and that, again, like I said, that's whether you stay with the school system or you come off. This is what your out-of-pocket would look like. So if you chose this first plan that's on this page, Silver Script Choice, you're going to pay $48.90 a month. You have a $590 deductible, and then you have copays at the drugstore until you've reached $2,000 out of pocket. We use Medicare.gov at our office to help us determine what plans are best for you based off of this information. Because this is a lot of plans, so instead of calling every single one and asking them if they cover your medicine, how much it would be, you put the information into Medicare.gov. And I will show you that after all the presentations are done. We can play with that. I don't want to get on that right this moment. Any questions on the Part D piece of it? You've gotten a whole lot of information in a short period of time, but I want to be cognizant and give everybody the opportunity to ask questions in a little bit. Another option for you is the Medicare Advantage plans. Yes, ma'am. You, as the policyholder, would not pay more than $2,000 if you are a retiree on Medicare. So we talked about the prepackaged cake at Walmart. That's a Medicare Advantage plan in that everything is all put together for you. The doctors are already lined up because these plans feed off of networks. So you have a list and actually I have it, I think, up here. Let me see. Hang on one second. No, I didn't. I take it back. I'm sorry. You have a list in your handouts that say 2025 Advantage Plans, Lafayette Parish. These are the plans that are available outside of the school system. These have nothing to do with what you as a retiree through the school system have. This is for just any Medicare beneficiary. My parents are eligible for one of those plans if they so choose. If you decide the school system is not your cup of tea, and you want an Advantage plan, this is where you would go. These would be your options. So these are plans that are sold by companies, Humana, Blue Cross, Aetna, People's Health, WellCare, Ochsner. Those are the ones that offer Medicare Medicare Advantage plans in your area. They package everything together. That's why I said it's like a prepackaged cake. It's already set up for you. It's got the doctors. It's got the hospitals. It's got everything that you need all in one. It also gives you those other benefits that many people like. The vision, the dental, the hearing. All of that is there for your liking. Now, one of the things that you need to know is that these plans also have out-of-pocket maximums, which means when you reach that cap in paying doctor, hospital, medical services, those copays reach that amount, whether it's $6,700, whether it's $3,800, whatever the case may be, the plan covers your health care for the remainder of the year at 100%. So for some, this is a good option. For others, it's not. I'm going to read you. Let's go across. We'll look at the first one on the page, which is Aetna, just so everybody understands how it goes. So this is an Aetna Medicare Signature Plan. It's an HMO. How many of you know what an HMO is? One or two, three? Okay. So it stands for Health Maintenance Organization. What does that mean exactly? That means that all of your doctors have to be in that network. They cannot not be in that network. Well, I'm still not following, Vicki. That means that your doctors have to be willing to take that insurance, accept what that insurance is going to pay, and be happy with it. They do not get the option to say, well, I'm going to take it for you, but I don't take it for anybody else. No, they're in the network for that Aetna plan. They are a preferred provider. You're on a one-way street, so everybody is in that network. Lafayette General, Dr. Smith, Dr. Jones, Dr. whomever, they all take it. When you go to that plan has a 0 monthly premium. What? 0 monthly premium. No, you still have to pay your $175 a month Part B, but you do not pay any extra to that plan for this particular plan. It has, because Medicare pays them so much money a month to manage your health care. Out-of-pocket max is $6,900. When something catastrophic has happened and you've had a lot of medical expense in a calendar year, you may get to that $6,900 early. Then that plan's going to cover you for the remainder of the year at 100%. Your primary care doctor is $0. Your specialist is going to be $10 to $35 depending on the specialist that you're seeing. If you go in the hospital, $380 per day, days 1 through 7. $380 per day, days 1 through 7. Well, what if I stay 10 days, Vicki? $380 per day, days 1 through 7. Those other 3 days are at no cost. Or if you average it out, it's still factored in there at $380 a day. It has prescription drug coverage. You have a $175 vision benefit. You have $2,000 in dental. Now that, again, you have to make sure that your dentist is in the network and that the things that you want to have done are covered. It's not free will dental coverage. So there will be some limitations to it. So it is important that you find out before you sign on the dotted line, I need a crown, I need a tooth pulled, I need this. Is that covered? They have to outline what is not covered is easier to find than what is covered. $500 hearing benefit. So if you need hearing aids, I'll give you $500 toward one. And $15 a quarter in over-the-counter benefit. Quarterly. Now, jump down one line. Aetna, Medicare, Eagle, Give Back. It's a PPO. It's a preferred provider organization. So the first one, you have to be on the straight and narrow. There's no veering. The second one, the PPO, you can veer to the left or to the right. But when you veer off the pattern or the road, you're going to pay a little bit more. So this one has a 0 premium, and it will pay $85 toward your Medicare Part B, as in boy, premium. No, it's not going to send you a check. What they will do is they will notify Social Security that Susie has signed up for this plan, and Aetna will pay $85 to Social Security every month on Susie's behalf. So when it comes time to make her deduction of $175, guess what? They're not going to deduct the full $175 because $85 of that is being paid by Aetna. So they're only going to deduct what? $80, $90 out of my Social Security check. So basically my Social Security check will go up $85. Y'all follow me on that part? Okay. Now, it has some out-of-pocket max. $67.50 on the left side means that all the doctors are in the network. They're all preferred. $10,100 on the right side means that they are out of network, or some are in and some are out. But if you got any that are out of network, you're going to automatically jump to the right side of the slash. Your primary care is going to be $0 to $5. 0 in network, $5 out of network. Remember, you can do that right or left side of the road. The specialist, $35 or $50. In network is $35, out of network is $50. Hospitalization, $285 per day for days 1 through 8, or 35% if you go to an out-of-network hospital. This one does not have does not have prescriptions. So really the only people that would want to look at this plan would be potentially veterans. That's kind of where this plan is targeted. But there may be some that get it. Vision is $300 benefit per year, $2,000 in dental, $500 in hearing, and you get $120 over-the-counter benefit per quarter. Now, you cannot take this plan and pair it with one of these. Doesn't work that way. If you need prescription drug coverage, then you have to choose one that has drugs added to it. The ones, when you go down the list that have no beside them, are basically targeted, or I shouldn't say targeted, they are tailored more toward individuals that go to the VA for their prescriptions, but want some coverage out in the, to use outside of VA. Yes, ma'am. Yes, ma'am. Yes, ma'am. If you choose a Medicare Advantage plan, you are basically choosing what they call a replacement plan. So, and I put my credit card up. Your Medicare goes behind this plan. This plan, whether it is Aetna, Blue, Humana, Peoples, or Ochsner, or WellCare, become your insurance. They dictate to you where you can go for the most part, who you can see for the most part, and what your out-of-pocket costs are going to be. Right now, that open enrollment period, this yearly, if you say you join Aetna and you decide you don't like it, okay, this time next year, you can go back to original Medicare and pick up a prescription drug plan. You can go back to Medicare. You just won't be able to come back to the school system if you leave the school system. If you take one of these plans on this piece of paper, okay, this piece of paper only, the school system has two plans for y'all, a Blue Cross and a Humana plan. Humana's on this page as well, okay? There's a difference. If you find Humana on this piece of paper here, you will see that there's some numbers in that third column that say H 1951. It starts with 049 and it goes down and it goes over on the other side to like H 1951, 049, 054, and so on. Under the school systems plan, it's going to have the H, basically, I'm assuming, 1951, but it will say dash 801 or 802. That tells me it's an employer plan. That number 8 is the key to tell me that it is an employer plan, and you have special privileges under that plan, special options. Whereas under this plan, how it's dictated is how it is. There's no exceptions.
There's a lot of misconceptions of you lose Medicare. You don't lose Medicare if you go to Medicare Advantage. You will always have your Medicare. I've heard that on a couple meetings that we've been to. You do not lose your Medicare. You have earned that. You don't lose it if you go to Medicare Advantage. When you have paid into it, you do not lose your Medicare.
But if you lose Medicare as your primary.
As your primary, yes.
The insurance company makes the determination of what
Well, if you
services.
have Blue Cross now, that's
Kind of does the exact same thing.
thing if you have Blue Cross now. It does the same thing.
But you present,
Because it's the secondary, but we have Medicare as your primary, and they're the ones that really make the decisions
Well,
for
when you
us.
had Blue Cross as, when you were active employee, Blue Cross did the same thing. They dictated who's in network, who's out of network. They did the same thing when you were active employee.
so I have a Blue Cross. I'm a state employee, and I have Blue Cross. And the plan that I have, the Magnolia Local Plus, which is an HMO plan. So I've got doctors and hospitals that I can see. When I retire and pick up Medicare and I stay with this Magnolia Local Plus, again, I'm going to have Medicare, but I still have to follow Blue Cross's lead. They're going to say, okay, Vicki, here's 3,000 doctors for you to choose from. We are going to pay on your claims. Medicare is going to pay us, being Blue Cross, to manage your health insurance, and you have to follow our rules. We tell you it's a $25 copay at the cardiologist. That's what you have to pay. We tell you it is $100 a day if you go in the hospital. That's what you have to pay. I still have Medicare over here, but Blue Cross is basically being my insurance carrier. I haven't lost my Medicare, but it's just following behind Blue Cross is telling me what to do. They do that now. They do that now.
I mean, if we have Medicare and Blue Cross as a supplement, I've never had one question. But I have a concern if the insurance company is my primary.
Okay, I tell you what.
The insurance company is there to make money.
Okay, I tell you what. I've given you a whole lot of information, and I think we might want to take a break. So let's come back about 10:30. And then at that time, Miss Trish is going to come up and talk to you about the options that y'all have, okay?
Good morning, everyone. I tried to walk back outside to see if everyone had come back in. It looks like they did. Y'all ready to get started on the other portion? Okay, good morning. So just for a real quick recap, we invited the Louisiana Department of Insurance just to tell you, about Medicare, okay, what your options are as a member who has Medicare, okay? Then she just wanted to also tell you that you do have options outside of LPSS. As when I'm going to go through the open enrollment guide that I sent out to members on Friday, there are some premium increases located within the guide. So obviously it could become a financial burden for some of you, which is why we wanted to make sure that the state was here just to tell you that they are a resource for you should you need them. And to just offer you some additional materials that they could put in your hand and you could walk away with. So that was the main purpose of having the Louisiana Department of Insurance come and speak to you today. So everyone was provided the open enrollment guide when you walked in. It was in the little folders that you got handed to when you walked in. So that's what I'm going to talk through. I'm going to do it real high level is how I'm going to describe it. I'm going to say I'm not going to get in the weeds. I know each one of you in here has a lot of personal questions. Maybe me and my spouse are this. What would our scenario be? We're going to have to tackle those one by one is how we're going to have to tackle them. But I want to just give you a real brief overview to tell you what went out. To let you know, again, reminder, if you for some reason did not get our communications, we do communicate from the department on a regular basis. We send out emails. If we have your cell phone and we can text and you can open up a PDF on it, then you can pull up the information on your phone as well. And then 9 times out of 10, when we send out a mass important communication, we try and call you and go, hey, if you haven't checked your email today, pull up your email. You've got something that's important from insurance. I'll just encourage you also to tell your friends. You know your retiree friends who are retired with the district. If they are not in the know, please remind them that there are changes that have happened to their group health insurance. We are going to send out a postcard. We're working on finalizing that too. But y'all know like I do, it takes a bit for the postcard to make it to your doorstep, okay? We're getting ready to send out that postcard within this week. it should hit doorsteps. But keep in mind, if you notice at the top, your group health insurance retiree open enrollment, should you want to make any changes with the district, is only going to be until the 22nd of November. So that's why it's important. If you know somebody, please let them in the know. We also put it on our website. It's under the LPSS Insurance and Benefits website. If you go to departments and then insurance and benefits, there's a plus sign there that talks about communications, 2024 communications. That's where, if for some reason we don't have your email, you weren't able to receive a text with the PDF, you can go directly to the website and pull up the exact same information there too. So we're trying to put as many resources in your hand as possible, knowing that with instances like mail or postcards, it does take a bit just to get to you. So let a friend know is how I'm going to describe it. Let your other fellow retirees know. So let's just work through this real high level. And let me just tell you what you have in your booklet. So I like the district pictures. We work in a very beautiful office, so I captured some really good pictures. I like that. So the cover page, if we just start off, let me try and zoom in. Okay, A, you've got certain dates for open enrollment to which you need to take action. Okay, if you don't need to take any action and everything's good, and I'm going to describe in more detail throughout the presentation and tell you if you're a Blue Cross member or perhaps you're entertaining the LPSS Humana plan, or maybe you don't want to stay on either anymore. You know, if that's you, I'm going to try and walk you through and give you some tidbits on what you need to do. But those dates are going to be super important. The end of open enrollment for retirees will be the 22nd of November if you need to take any type of action at all, okay? So let's just look at Blue Cross Blue Shield health insurance first off. If you're happy with your LPSS Blue Cross insurance, you don't need to do anything, okay? I do have a packet that has the premium increases. I'm going to briefly discuss that. The board did vote for a 50% increase to retirees who have Medicare A and B, okay? That's going to be impactful for several of y'all in this room. If that's the case, then if you keep your Blue Cross, your premium will increase, and then effective January 1st, you'll just stay on Blue Cross. We don't need you to contact our office. We don't need you to do anything. Make sense? I'm talking about any retiree of the district. So if you have our Blue Cross in and of itself, whether you're receiving a premium increase this year if you're 65 and have Medicare A and B, or you're just a retiree and let's say I'm 55, I'm under age 65. If that's you and you just want to keep your Blue Cross, you don't technically have to do anything. Does that make sense? It's just going to roll over to the next year like normal, any other year. Okay, then come and see us at that point in time. But your Blue Cross is still going to continue unless you cancel it with the district. Doesn't matter. Her question was, are you talking about Blue Cross as it being my supplement or my primary? I'm talking about if you have LPSS insurance, Blue Cross with LPSS. That's what I'm referring to in particular. If you want to keep your Blue Cross with the district, ma'am, doesn't matter whether it's supplement or not, because I do have some retirees in here that aren't Medicare A and B. But if you have Blue Cross with the district and you don't want to do anything, it's just going to roll over to the next year. Now, if you're Medicare A and B, you will have a 50% increase in premium. Yes, ma'am. As of January 1st, exactly. But I'll get to that premium sheet and we'll pause on that one for you, okay? So, A, I don't want to do anything. I'm just going to roll over to the next year and I don't need to take any type of action whatsoever, okay? That could be a large majority of people in this room. If that's you, you essentially don't need to take any action, okay? Maybe I want to change plans, but keep in mind my Medicare eligible members cannot go off of the basic plan. You have to keep the basic plan, okay? Maybe I have a 55-year-old retiree in this room who wants to go from the enhanced plan to the high deductible plan. In that example, that would be their plan change for the given year effective January 1st, okay? I'm thinking a large majority of everyone in this room is probably A and B eligible. Am I thinking that through correctly? I see nods. Okay. So, or you could cancel your plan with the district, which is why we just brought the state in, just so that Louisiana Department of Insurance, that way they could just give you some information. You could cancel with the district, but it would have to be prior to the end of our open enrollment period on the 22nd of November. And then you would keep benefits with LPSS until 12/31, and then those benefits would cancel with the district. I'll just use a lot of caution. Remember, if you cancel with us, you cannot return back to LPSS. So please, I encourage you, take the information that you have if you are thinking about leaving the district insurance, because if you cancel with us, you cannot return. Okay? So keep in mind, any changes that you make during open enrollment, they're going to stay the same until 12/31. And then if you're canceling with the district, yes, ma'am, we're going to have your cancellation form. We're going to stop your Blue Cross insurance. We're going to update your pension. I see where you're going with that. I'm going to update your pension, and I'm going to take you to zero. Yes, ma'am. Her question was, my January check will not have a Blue Cross. Keep in mind, if you adhere to the deadline of the 11/22, yes, ma'am, you are correct. We will get your form from you because it has to be in writing. Key pieces there, okay? We would cancel your Blue Cross as of 12/31 in that example. I would update your pension to a zero deduction through your pension for January 1st, okay? No, you're going to need to take all action with the LPSS Insurance and Benefits Department. You do not contact Blue Cross directly. Does that help clarify it? Okay. Okay, so I have a feeling where a lot of the questions are going to arise this morning are our new hybrid premiums that we're offering. I have a feeling there's going to be some confusion, rightly so. It's something that's happening that's new. So let me try and explain it briefly. I'm going to go real high level here. What's going to happen is typically, historically, we have always required a married couple with the district to stay under the same LPSS insurance. So if I have, for example, two Medicare eligible members who are, I'm going to use husband and wife is how I'm going to describe them, that both are Medicare A and B, we have required that they stay together and stay under the same plan. We've now created some hybrid scenarios that may work better for you and your spouse, where maybe you want the Humana plan, LPSS Humana plan, keywords there, and then your spouse may want the Blue Cross LPSS plan, okay? So we're calling those type scenarios hybrids, okay? I've got a real quick cheat sheet a little bit later on, but I wanted to at least describe it for you so that you knew what I was talking about. So now moving forward, as of January 1st, we're going to allow couples that are eligible, that are already on our plan, all keywords right there. Nobody can add on. Okay, you determined your enrollment at the time of retirement. So this is already LPSS members who are already on typically our LPSS Blue Cross Blue Shield health insurance plan. Everyone tracking with me? Okay, so we're offering a choice of maybe spouses, married couples wanting to do something different. to include if they're not Medicare eligible. Maybe your spouse is not Medicare eligible. That was my alarm, just to keep us on track, y'all. Sorry. So at least we're offering an option for you is how I'm going to describe it. So, and then, of course, I don't think I have any LPSS Humana Group Medicare Advantage members in here, but know that this is their opportunity to make changes too. We have about 430 members under that plan. If they want to perhaps cancel the LPSS Humana plan and move back to the Blue Cross, that would be their opportunity to do so. I'm going to ask that you connect with our department, and we'll work through that process with you. Okay? They, too, could cancel that policy. If they cancel the policy, they cannot return back to the district. All key pieces there. Okay. It's going to be members who have our Blue Cross is where the mail-out's going to go. I don't want to confuse our Humana members because it's more specific to the Blue Cross members with regard to the premium increase because Humana does not have one. So within the packet is your contact information. There's department info. I'll just preface this by saying the department not only has retiree open enrollment going on right now, which is now 2,700 plus members, just alone under Medicare A and B, but I have 3,300, 4,000 active members. I have a lot of moving parts in insurance right now, so I'm going to ask for your grace and your patience and your understanding because I have staff here today. I have some staff here today trying to make sure that we help field your questions, answer your questions, but we, again, have work in emails and phone calls and everything. So please leave us a voicemail. I promise we've been dividing and conquering and been trying to reach out to you and let you know that we got your message. We're trying to work on it. Or we'll reconnect with you if you send us an email. But leave us, I'm going to encourage you, leave a message. Sometimes y'all like to ring a couple different phones and then no message is left. I'll be honest, there's a lot of phone calls coming through, but if you'll leave a voicemail, then we'll know that you called and we'll reconnect with you, okay? So I also listed your Blue Cross information. They've actually changed their name. They're now Louisiana Blue, but you can see their 1-800 number listed on there. And then, of course, this is our specific to our group plan, the LPSS Group Medicare Advantage plan specific to LPSS employees. I will encourage you that if you are entertaining or wanting to ask some additional questions of Humana customer service, that you call that 866 number to get assistance and get out all your prescriptions, get out all your medical information, maybe the physicians in the facilities that you go to, and ask those questions. I call it vetting. I want you to connect if you are even entertaining or thinking about. I wouldn't want you to make a change and it be a poor change for you. So I'm going to ask that you call Humana customer service ahead of time just to get those questions answered for you. Okay? So, next page, it reiterates what we talked about at the beginning. If you don't want to make a change at all, no action is required on your part. Okay? It's going to roll over to 2025, and depending on which type of retiree you are, will depend on whether your premium increases. Like if you're Medicare A and B, there is a 50% increase effective January 1st. Our pre-65 members, they are going to align with the active member premium, so they will not see a premium increase. They would have already gotten it in July 1st of 2024. Obviously, if members who want to change or cancel, it gives you some direction there. And then it gives you the point of contact information with regard to how to connect with LPSS. Because there are so many retirees, if you are wanting to come by district, we're not offering one-on-one meetings right now because there's a lot of retirees wanting a lot of information all at once. We are offering drop-off times for your forms. Let's just say you want to change a plan or you want to cancel your plan. I have reserved a room that would allow you to come. Staff will be in the room. We won't be able to have a 20 or 30-minute individual conversation, but we can certainly work through the process, let's just say you've perhaps already connected with an outside source and you know that you want to get off of LPSS insurance, you automatically know you want to cancel the policy. We're offering drop-off times for those forms where you can come to the district office and you can submit those forms directly to staff and we can take them from you, okay? So just know you've got some point of contact information there. So here is the premium increase info. So let's go to the first one where it's the pre-65s. Let me zoom out just a bit. So if you'll notice at the top of the form, we tried to identify every type of retiree because we've got quite a few. We have our pre-65 retirees. We have members who are over age 65 and they do not have Medicare A and B. We have some Medicare members who have A or only have B, one or the other. And then we also have some LPSS retiree return to work within this premium chart. If you fit within any of those groups, this is your chart. That's the easiest way to say it. Because there's so many of y'all, that's why we try to group them into separate charts moving forward. Yes, ma'am. She asked if her 65th birthday is in April. Right now, you're pre-65, so you would fall under this chart. However, when you do become Medicare eligible, as of May 8th, the board did make it mandatory. Medicare eligible members, in order to stay under our plan, you do have to go into the Medicare office and get your A. You likely should have earned your A through yourself or your spouse. And then based on that, you would enroll in your Part B in order to stay under our insurance. It's not Social Security. It's your Part A would have been from your work history. Okay. I can talk to you individually. She's saying that she didn't have it, but essentially you would get a document from CMS that states that you're not eligible, or a spouse that you can't earn Part A off of a spouse. So it's going to have to be a document certification of. Yes, sir. Because you're still working, if I'm remembering correct. Wasn't that your example? If you're still working, let's talk through your individual scenario, because I believe your spouse is retired, correct? Okay. Connect with me. Let's talk through you, because that may get them all sideways. But I promise, we'll connect with you. Then you're under this chart because you don't have B right now, but you're over 65, correct? Mm-hmm. Does that make sense? So this is a catch-all for every other retiree at LPSS is the easiest way I can describe it. You're likely in this group if you don't have Medicare A and B. Does that make sense? We identified every retiree of the Lafayette Parish School Board on this chart. Yes, sir. I see your hand. It keeps... Okay. Mm-hmm. Which is correct. Yes. Okay. You will. Okay, so his question was, A, I'm pre-65 right now. I'm getting ready to turn 65 in January. Correct me if I'm wrong on any of this, sir. I've got my card in the mail and I need to come by your office. That was essentially his question. So right now, until the end of the year, he will not have an increase, but he's going to transition effective January 1st with Medicare A and B, and then he would fall under the next premium chart that I'm referring to, and then you would be under that 50%. Yes, sir. So... So her question was, is there a window of opportunity? Ms. Vicki did briefly describe that. You have a window in order to elect Part B in particular. You likely have already earned Part A. You would have to go to the Medicare Social Security office When you go, you have, it's 3 months before your 65th birthday, the month of, and 3 months after is your eligibility window in order to apply for Part B. The district gives you 90 days in order to elect it and then bring it to our office so that we can record it on file for you. Okay. So let me roll to the next one because I have a feeling that's where a majority of our questions are going to arise. So this is I'm going to focus on the top part first and scroll in. That way you can see it up on the screen, and then we'll scroll down. A large majority of you are going to be in the basic, because if you have Medicare A and B, LPSS requires that you fall under the basic PPO, is how I'm going to describe it. So if you look at the top, these are the new rates with the 50% increase, with the 50% increase. So if I just take the first one, the BM rate on the very first line that you see for 165, that is currently our $110 rate, okay? It has the 50% already added onto this chart, and these are your new rates effective January 1st, okay? So right now you're paying the lesser amount. Come January 1st, the new increase will upload. If you're doing nothing, remember under Blue Cross, these are going to be your new rates if you're 65 and older with Medicare A and B. The column with the green, sir, is the one with the 50% in it. It does have that new total in it for you, if that's what you're asking. So, are you both retirees of the district, sir? Yeah. You're double LPSS retirees? You both worked for the district and you retired? Yeah. Okay. So then you are likely falling under both. You should be at the 323 rate if I've looked at it correct, because it's I'm retiree plus one, both with Medicare A and B. Double LPSS, your rate should be the 323, but we can double check that with you. Okay. We'll help you work through that process. So the chart includes the 50%, okay? And again, if you'll notice, we've got these hybrid totals and new premiums on here available for you. Let me talk you through the rest of it, and then I'm going to show you. Let me grab something real quick. I'm going to talk just briefly on the hybrids because I do know it's 11 o'clock. I don't want to extend your time here, but let me just explain a few things. That way you walk away with some understanding. Let me try and give you a couple examples based on those hybrid scenarios. So the basic PPO, remember we just spoke a minute ago, if I'm a retiree only of the district with Medicare A and B, if I stay under Blue Cross as of January 1st, my premium is going to be $165, okay? If I were to move to the LPSS Humana plan, my premium is going to drop to zero. Zero monthly premium versus $165 per month, okay? I'm just trying to give you some options so you can visually see them on the screen. I'm not trying to encourage anybody one way or another. I'm a visual learner. If I can see it, then I understand it better. So let's just go through another example. Retiree and spouse, both with Medicare A and B, okay? With the new rates, if you stay under Blue Cross, and I put the codes out to the side of them so y'all could reference them with the chart. If you both stay under Blue Cross, you're looking at $371 as your new premium effective January 1st, okay? If you both move to Humana, $49 per month versus the $371. If the retiree moves to Humana, they would pay zero, and then this is where those hybrids come in. The spouse stays on Blue Cross. I have a reduction from $371 if y'all both stay under Blue Cross to $206 if one goes to Humana and one goes to Blue Cross. I'm just trying to offer you some alternatives. Or in the alternate scenario, spouse moves to Humana, $49, plus the retiree staying under Blue Cross, you're looking at a monthly premium of $214. So if you stay where you're at, y'all are going to be paying $371. I've given you some other alternatives to look at, it depending on what you would choose in those examples. I'll go through one or two more, and I'd be more than happy to. This is not in your packet. I just thought I'd pull it up on the screen today. I wanted to give you some examples. I'll go through the, let's look at the next one. Medicare A and B retiree and a non-Medicare spouse, okay? Like for me, my husband's a couple years older than me. I'm younger. So if we were both to stay under Blue Cross, it would be $518 per month. If he, let's just say he was Medicare eligible and I'm retired, if he went to Humana and I stayed under Blue Cross, it would be a $353. So by giving you the additional options or choices, you could reduce your premium, but it would require one of you to make a change, or perhaps both of you to make a change. Okay? Otherwise, if you stay where you are, then the premium will just increase based on the 50% approved by the board. So I know each one in here has a likely different scenario. We'll be happy to take your name and number, email you the information back for your what ifs. We won't be able to go through 20 what ifs, but we can certainly talk it through with you. I don't want you making decisions that are going to affect you poorly. If it takes a couple days for us to connect with you to try and make you understand, if you just have a little bit of patience with us, we'll be happy to connect with you and figure out what your individual circumstance is. Okay? Yes, ma'am.
As long as we stay with one of y'all's insurance, Blue Cross or Humana, if we choose Humana, disenrollment, we cannot change to Blue Cross next year?
So her question was, if I decide to move over to the LPSS Group Humana plan, can I decide to go back to Blue Cross next year? Currently, that window is still open. The board is still allowing that to happen. Just know whatever decision you make for January, you have to stay under that plan for the entire year, whether it's Blue Cross or whether it's Humana. You're going to have to stay put. And then we'll have another open enrollment in the fall every single year. We'll have this opportunity for you again. And then, yes, you could go back to Blue Cross if you choose not to. If you choose to go back, I'm sorry. I think I got turned sideways. Yes, ma'am.
When you say Blue Cross, that's the general Blue Cross with silver scripts, which covers your medicine, okay? That is different from Humana. The Humana is an advantage. It's totally different from the other two together.
Okay. So her question was, currently, I'm a large majority, if not all of you, have the LPSS Blue Cross plan in here, okay? If you are 65 or older, you have silver scripts, which is your prescription coverage, okay? I call that like a combo deal, like a fry and a Coke, okay? It works together. You can't have one without the other, okay? You would have to cancel your Blue Cross and silver scripts, essentially, and then transition to the LPSS Humana plan, which is a group plan. You won't have Blue Cross or silver scripts anymore, and then you would go under Humana effective January 1st. And then, again, you'd have the opportunity to return during the following open enrollment if for some reason it was not working as you thought it would. Make sense? Yes, ma'am. Okay.
Why does it say retirees must be on the medical advantage plan? What is that highlighting?
Talk to me individually. You shouldn't be a retiree of the district, have Medicare A and be under the high plan. You should be under the basic plan. So let's take a look at your scenario, because you shouldn't be. When you obtain Medicare A and B, in order to coordinate with our plan, you have to be under the basic plan. So it puts me for pause right there, but connect with me and I'll help answer the question further. Okay. Okay, so yes, ma'am. Yes, and I do have that in here. Hang tight just one second, ma'am, and I'll help answer your question. So the forms, all the forms were listed on there. They may be a bit overwhelming. There's a lot of info on each one of the forms. Let's just say you want to cancel or perhaps change plans. That's why I'm going to have staff available for you when you come to drop them off, or should you want to cancel coverage or change a plan. Remember, Medicare eligible members cannot change plans. Okay, you got to stay under the basic plan if you have Medicare A and B. So that's just your forms page. This tells you about your benefits with LPSS. If y'all remember correctly, May 8th, the board approved changes to the basic and the enhanced plan, and they increased those deductibles. That is taking effect for both retired members and for active employees effective January 1st. The basic is going from $950 to $1,200, and the enhanced plan is going from $800 to $1,100. Okay? So those are affecting your Blue Cross plan this year too. So that's why we tried to stick it on that piece of paper. May was a long time ago. I forget what yesterday was sometimes. So just friendly reminders that you do have deductible changes if you're under the basic and the enhanced plan too. So your question, ma'am, here's that Humana page. We are still holding an informational for those members who would like to learn more about Humana. I encourage you to do a few things leading up to that point is how I'm going to describe it. If you remember at the beginning, I said, please call customer service. Grab all your prescriptions, figure out who your pharmacists, get your prescriptions together, figure out what doctors you see and what facilities you see, okay? I encourage you to call Humana ahead of time. Customer service is already taking phone calls from LPSS retirees. See whether you may have a change in facility or doctor. See whether that prescription is covered under the LPSS group Medicare Advantage plan, okay? They can walk you through specifically your needs on the phone through customer service. So A, I would start there, okay? 2, you're going to get that informational booklet in the mail. Humana is getting a census from us. We're going to send it out to every LPSS Blue Cross member who currently has Blue Cross. Humana members already have it. There's no need to send to them. It's informational. Doesn't require any action on your part, but at least it will be in your hands and you can physically take a look at it. Then we are going to have, I've asked y'all to save the date. If you're interested, mark it on your calendar. November 12th, it will not be here at the district office. We're working through a location that's larger. That way we can have more individuals off property. But there will be a morning and an afternoon session, kind of like what we did today. So put that on your calendar and at least save the date. And then if you get to 1, 2, and 3, and you're on board for possibly making a change, then we are going to provide some resources for you within that booklet that comes mailed to your doorstep on what you need to do to enroll. Keep in mind, if you enroll in the LPSS Group Medicare Advantage plan, you're going to have to cancel your Blue Cross plan with us here at the district, which is why we try to list several dates and times where you could come by district. We'd have a staff member here. If you needed to cancel, I need a written cancellation form from you if you're going to enroll in the Group Humana plan, okay? Keep that in mind. And then, of course, enrollment into the plan, we're going to provide 2 options for you. One will be via telephone where you can connect with a customer service rep. The other will be an online resource. If you're like me, I like to talk to somebody. So just know that you're going to have 2 resources. It will be detailed out in that packet should you be interested. Keep in mind, moving forward, this is something a little bit new. I'm sorry, y'all. Moving forward, we are starting a new process. You have to have one of those 4 criteria in order to enroll in the LPSS Humana plan moving forward. So A, open enrollment is your opportunity to do so. If you become Medicare eligible, that's an opportunity. During a mid-year qualifying event, that would be an opportunity, or canceling. A lot of you in here are already retired, but that would be like an active member transitioning to retirement. And I'm almost done, y'all. I appreciate your patience. Okay. So keep in mind, based on those 2025 changes, members who have the basic plan, that prescription deductible under SilverScripts went from $100 to $250. So that was a notification too. Gallagher discussed it at the 9/18 board insurance committee meeting, just to notify you of the changes that the superintendent was signing off on the contracts. There is also a change to high deductible members too. This includes both active employees and retirees. Anyone that's under the high deductible plan will transition from Express Scripts under their pharmacy to RX Benefits. So just some notifications there of the changes, and that if you are under those plans, you're going to need to make sure to be on the lookout for your card, and then you're going to need to make sure to tell your pharmacy that you got a new card. And then just a friendly reminder, you cannot drop. If you have A and B now, you got to maintain A and B, okay? In order to keep group health insurance with the district, it's just friendly reminder, you've got to maintain it. The district is not requiring, let's just say I don't have my B, or I didn't have my A, and now I'm 67, 68. We're not requiring that you go and get it. That's not what the board approved. But you have to maintain it if you currently have it. And then if, as of May 8th moving forward, you have to go get your B. You have to go visit the Social Security Medicare office and get the B based on your eligibility window. Don't forget about 3 months before the month of 3 months after. I know it was a lot of information that we gave to you today. I appreciate y'all listening, asking the questions that you asked. Do I have any other questions? Yes, ma'am. So when the board finally made the decision on the 10-9, Humana started working on the 2025 changes. It's taking them just a bit to get those booklets and everything together. Yes, ma'am. It's going to come to your doorstep about the last week of October, first week of November. That would give you an opportunity to take a look at it there. And then that's also going to give you an opportunity to come to the 12th of November, should you want to that save the date. And then, yes, your end date for making any type of decisions with the district would be on the 22nd of November.
Will we all get the Humana booklet?
Yes. You have Blue Cross right now, ma'am? Yes. Any Blue Cross member who is a retiree of the district who has Medicare A and B will get those Humana booklets in the mail. Yes, ma'am. Yes, ma'am.
This might be off beat, but all of you say non-grandfather. What's the grandfather?
It's a long answer, but it has to do with the Affordable Care Act. Your Blue Cross has always been non-grandfathered. It's just stating it on there. It's in writing. Yes, sir. We're going to notify all retirees, ma'am. If you've been receiving our emails and our text messages and our phone calls, you're going to get something from district in addition to getting something in the mail. We're going to tell you about it, then we're going to remind you about it, then you're going to get your information in the mail. So you'll get several. It's just not 100% firmed up just yet, but I do know that the wheels are turning, and I do know it's going to be an outside location from the district office. Yes, ma'am. It's going to be specific. Her question was, how will it be different? It's going to be specific to our LPSS group health insurance Humana plan. That one's specific to the group Humana plan. I didn't want to muddy the waters, and I wanted you to strictly hear from Department of Insurance just based on what your Medicare benefits are. Then I wanted to give you the information about what you're being offered under open enrollment, And then we'll keep the Humana event specifically to Humana. Yes, ma'am. Any other questions?
The meeting next week, I think you have one Wednesday, is the same as which
Exact same thing. Yes, ma'am.
I signed up for that one, thinking it was the Humana one. So how can I let you know that I'm
That's okay. We can, if you can give staff your name in, we'll make sure to remove you. If you've signed up for multiple of these meetings, no need to. It's all going to be the same one. We've recorded the one for today. I'm going to send it out via email once IT gets it completely wrapped up. That way, anyone who could not attend, they'll have it via video. They can always go to the YouTube resource. But well, I appreciate your time. I appreciate y'all coming out. I appreciate you listening. If you have any questions, there are a few staff members in the back. Maybe we can get your name and number or email address if you've got something specific, and then we'll reconnect with you. But I appreciate it. Yes, ma'am. They are. She asked about the forms. The forms, there's clickable links within that document. I try to keep it simple. They're at the top right here, ma'am, in the blue, if you're trying to look for the forms. Yes, ma'am. Or just come on the dates. Look. Come on these dates right here. And we're going to have all those forms available to you, and I'm going to have a staff member there for you. We're going to rotate and make sure someone's there to help you. Any other questions? I appreciate y'all coming out today. Thank you again so much.